Hello, Alabama. Welcome to Viva Medicare's Making Medicare Easy. I'm here to help you understand the basics of Medicare and answer common questions people have about Medicare coverage. In our time today, I'll explain the different parts of Medicare and show you examples of how they work. I'll also introduce you to many of the outstanding perks of being a Viva Medicare member, including how you may be able to save money with a Medicare Advantage plan from Viva Medicare. Finally, we'll review some questions you need to consider before making an informed decision about your health coverage. By the end, you'll have a greater understanding of Medicare and the steps you need to take to enroll in the plan that best fits your needs. Now, as you may already know, Medicare can be confusing. Wouldn't it be nice if you knew who to call when you have Medicare questions? At Viva Medicare, we believe every member should have easy access to their very own Medicare expert, a trusted professional who looks out for you and has your best interest in mind. Our Viva Medicare local agents provide you with peace of mind and a personal contact that can help you understand your Medicare options. They'll check to see if your doctors are in our network, make sure your prescriptions are covered, and help you enroll in the right Viva Medicare plan for you. We're excited to say Viva Medicare has earned a 4.5-star rating for plan year 2020 from the Centers for Medicare and Medicaid Services. This is the 5th year in a row Viva Medicare has earned a 4-star rating or higher. What does it mean to be a 4.5-star plan? Medicare uses a star rating system to show how well a plan performs. The higher the star rating, the better a plan does at serving its members and ensuring they get the best care possible. One of the reasons we score so highly is because we're based right here in Alabama, and our members notice we treat each of them like a neighbor, not a number. And good neighbors take great care of each other. We're truly accessible, and getting in touch with us is easy. We have a number of locations across Alabama called Viva Health Cafes, where you can walk in and get easy-to-understand answers to all your Medicare questions. You can visit a Viva Health Cafe in Birmingham, Hoover, Montgomery, Mobile, the shops at Grand River in Leeds, and Florence at North Alabama Medical Center, and we'll be opening soon in Dothan at Southeast Health. You can walk right in and meet face-to-face with a local agent to discuss your Medicare questions and needs. Can't make it to a cafe? Call us and we'll come to you. We can meet you at home, a library, a restaurant, or wherever is most convenient to you. Our local agents are available to answer your questions, and we can even help you enroll in a Viva Medicare plan over the phone. That's how your Medicare coverage should be: fast, helpful, and easy. Make sure to visit www.vivahealth.com/Medicare, where you can see all our benefits, compare plans, and find local group enrollment meetings. Now, hopefully, with our help today, you'll discover the true value of choosing a local Medicare Advantage plan like Viva Medicare. So sit back, relax, and let us make Medicare easy for you. Medicare is a health care program provided by the federal government for adults 65 and older and people with disabilities or certain types of kidney disease, not to be confused with Medicaid, a program that provides medical care for low-income individuals and families. Medicare and Medicaid are two different programs, but there is a Viva Medicare plan made for people who are on both. Medicare is similar to typical health insurance provided through private health insurance companies or employers. With Original Medicare, doctors and hospitals are paid by the government. With a Medicare Advantage plan, the government pays private health insurance plans. Those plans then pay the doctors and hospitals. You generally become eligible for Medicare when you turn 65. You can join a Medicare Advantage plan like Viva Medicare during a 7-month window that begins 3 months before the month you turn 65, includes the month of your birthday, and ends 3 months after your birthday month. This window of time is called the initial enrollment period. If you choose not to enroll, You may only be covered by Original Medicare and will not be able to take advantage of the extra benefits that come with a Medicare Advantage plan from Viva Medicare. You can also become eligible for Medicare if you are medically disabled for 2 years or more before the age of 65, or if you have permanent kidney failure that requires dialysis or a kidney transplant. So, if you are eligible for Medicare, call us and we can help enroll you in a Viva Medicare plan that fits your needs and your budget. Let's break down the different parts of Medicare so it's super easy to understand. Medicare is divided into 4 parts: Part A, Part B, Part C, and Part D. Medicare Part A covers you in the hospital when you get hurt or sick. Part A can also help cover a stay in a skilled nursing facility or hospice care for the terminally ill. Medicare Part B provides coverage for medical services like doctor office visits, home health services, and outpatient tests. It also helps cover some preventive services to maintain your health and wellness or keep certain illnesses from getting worse. Medicare Part C is more commonly known as Medicare Advantage. Medicare Advantage plans combine Part A, Part B, and many times Part D prescription drug coverage. A Part C Medicare Advantage plan from Viva Medicare gives you more benefits in Parts A and B alone and may be less expensive. Part C Medicare Advantage plans are managed by private insurance companies like Viva Medicare and must be approved by Medicare. These plans must have at least the same coverage as Medicare and usually include extra benefits designed to help you save money, such as dental benefits, vision benefits, and worldwide emergency coverage. However, you must have both Medicare Parts A and B to be eligible for Part C. Now, this is important to remember. Medicare Advantage plans are offered by different insurance companies. Every plan will have different amounts you pay to see your doctor, go to a hospital, or pay for your medications. If you have questions about your current plan or are confused about your Medicare options, call us today. Our Viva Medicare agents can explain your plan options and help you understand the cost and benefits associated with each one. Finally, Medicare Part D provides prescription drug coverage, and it may help lower your prescription drug cost. It's important to look for a plan that includes Part D, as prescription drug cost alone can sometimes add up to large out-of-pocket expenses. Viva Medicare offers several Medicare Advantage plans that include Part D. In addition, Viva Medicare offers a home delivery service where most prescriptions can be automatically refilled and delivered right to your door. Just another way we try to make Medicare easy for you. Now let's take a look at how all the different Medicare parts fit together and what areas of coverage they're responsible for. Meet Charlie, a 65-year-old grandfather. Charlie is on Original Medicare. One day, Charlie takes his grandson to the park to play some football. While stretching to catch a pass, Charlie falls and injures himself badly. He'll need to spend the night in the hospital. Since he has Original Medicare, Medicare Part A would be there to help cover just some of his hospital cost. If Charlie only has Original Medicare Part A, his one-day stay at the hospital could cost over $1,364 in the form of his inpatient hospital deductible. Now, if Charlie had one of Viva Medicare's 2020 Medicare Advantage plans, the most that same hospital stay of one day would cost him is $295. Now, on the other hand, let's say Charlie only pulled a muscle in his shoulder while throwing the football. He wouldn't really need to stay in the hospital, but he might need to see a doctor to make sure the pulled muscle is not something more serious. In this case, Medicare Part B would help pay for his visit to the doctor. With Original Medicare, after the $185 Part B deductible, Charlie's Part B coverage would pay for 80% of the visit. And, unfortunately, Charlie probably won't know how much his remaining 20% share is until he gets the bill. With a Viva Medicare plan, Charlie would only owe a set copay for his doctor visit. More importantly, he would know this amount ahead of time. If Charlie sees his primary care physician, his copay would be $0 on all Viva Medicare plans. Now, we've talked about all the parts of Medicare, and you've heard us mention Medicare Advantage plans. You may have also heard about Medicare supplement plans. Many people on Medicare want to choose between a Medicare supplement plan and a Medicare Advantage plan. Let's briefly compare the two and see how they stack up. There are two main differences between a Medicare Advantage plan from Viva Medicare and a supplement plan offered by other companies. First is the premium. A premium is the monthly amount you pay for coverage. A Medicare Advantage plan from Viva Medicare has planned premium starting at $0 per month on top of your Medicare Part B premium. With a Medicare supplement, you typically pay a high monthly premium and also have to pay for a separate Part D prescription drug plan. Second, a Medicare Advantage plan from Viva Medicare may offer more benefits than having original Medicare combined with a supplement plan. For example, all Viva Medicare plans include $0 primary care physician visits, dental benefits, coverage for vision, eyeglasses and contact lenses, an allowance to buy over-the-counter drugs and supplies, full access to the Viva Health Cafes, and a fitness center allowance. Our members also enjoy the convenience of an all-in-one plan that only requires one member card. As a Viva Medicare member, your card will include your medical coverage. If your Viva Medicare plan includes drug coverage, then that same card will cover your drug benefits too. With supplement plans, you may need up to 3 separate cards, one for your Medicare benefits, another for your supplement plan, and then a third one for your prescription drug benefits. Keep in mind, some supplement designs are ending in 2020. If you're on one of these supplements, call us to see how a Medicare Advantage plan from Viva Medicare could save you money. When it comes to your health care, a Viva Medicare plan may be more affordable than relying on original Medicare on its own. Our plan options are designed to meet your needs and budget. And unlike original Medicare, all Medicare Advantage plans protect you with an out-of-pocket maximum. The total amount you spend on your medical care is limited no matter how many services you use. With original Medicare, the more services you use, the more you spend, and there's no limit to your total yearly cost. You also get additional perks with Viva Medicare that you may not find in other plans, such as generic drugs starting at $0 on plans that include Part D, $0 copay for diabetic testing supplies, and worldwide emergency coverage. Best of all, you'll be in a 4.5-star plan that has been rated highly by our members year after year. Look in your 2020 Medicare and You Handbook for Alabama to see our member satisfaction score. At Viva Medicare, nothing is more important than personal attention and being part of your community. This is why we opened our Viva Health Cafes throughout Alabama. We want you to know that you have a place to go whenever you need easy-to-understand answers to all your Medicare questions. And if you need help enrolling in a Viva Medicare plan, we can help you while you're visiting. That's just one of the many ways Viva Medicare is working to make Medicare easy for you. Now let's take a closer look at what else sets Viva Medicare apart from other plans. We're proud to say that Viva Medicare once again received one of the highest star ratings given to a Medicare Advantage plan in Alabama. The star rating gives Medicare beneficiaries a single summary score that makes it easy for them to compare plans. Because of our high member satisfaction and quality health care, our star rating helps us reward our members. We can offer benefits such as $0 primary care physician visits and smaller out-of-pocket expenses. As we mentioned earlier, not many Medicare Advantage plans in Alabama can say they've been 4 stars or better for 5 straight years. Can yours? Viva Medicare has been rated highly by our members year after year. This is because the people who work for Viva Medicare are people in your community. We're your neighbors and friends, and we take great pride in serving you. It's a big reason why nearly 50,000 Alabama residents have chosen Viva Medicare. Want to see how your plan ranked? Look in your 2020 Medicare and You Handbook. We have been providing affordable health plans to Alabamians for more than 20 years. Today, we still offer $0 per month Medicare Advantage plans in much of our service area. All of our plans are designed to help you save money on your monthly health expenses, and most of our plans combine medical and drug coverage. No separate plans to piece together, no multiple ID cards for different plans, just one easy, convenient plan that may help you save money. All Viva Medicare plans include $0 primary care physician visits. We encourage all of our members to live healthy and happy lives, and we don't ever want you to feel like you can't go to a doctor because of a copay. So next time you're feeling ill or have an injury, schedule an appointment with your primary care physician. We've got you covered. Have you been putting off a visit to the dentist? At Viva Medicare, we've got your smile covered. All of our plans offer dental coverage you can use for services such as cleanings, fillings, tooth removals, dentures, and other dental services. You are covered 100% up to the annual allowance, and you don't need prior approval from the plan. All Viva Medicare plans include coverage for over-the-counter drugs and supplies. This means Viva Medicare will provide you with an allowance for purchasing common over-the-counter items like pain relievers, allergy medicines, vitamins, toothpaste, and bandages. With Viva Medicare, you'll have plenty of options when it comes to your choice of doctors and hospitals. We have a large network of providers, and we're contracted with nearly every hospital in our service area. You're also covered for emergencies worldwide, so it doesn't matter where you are. If you have an emergency, Viva Medicare has you covered. Want to see if your doctor's in our network? Contact Viva Medicare by calling the number below. Or you can visit vivahealth.com/Medicare to look up your providers. Our members love the fact that our plans don't require you to get a referral to see contracted specialists like heart doctors or skin doctors. Other Medicare plans may require you to get a referral from your primary care physician before you see any specialist. That means you could end up paying 2 copays. This is a very important difference. Don't forget to check to see if your Medicare plan requires a referral. Viva Medicare only requires referrals for pain management. At Viva Medicare, helping our members take care of themselves is very important to us. Every Viva Medicare plan covers a number of important screenings at no cost, such as annual wellness visits, routine vision exams, flu shots, diabetic screenings, mammograms, and colonoscopies. Viva Medicare nurses work with doctors and members to help make sure you get the care you need to stay healthy. Viva Medicare focuses on giving you personal attention. Our Viva Medicare agents are here to give you tips and advice to help you understand your Medicare options. They can confirm your doctors and prescriptions are covered and provide easy-to-understand answers to your Medicare questions. Your local Viva Medicare agent can meet you most anytime, day or night. And they're more than happy to meet you in a setting where you feel most comfortable, whether it's at your home or at a local restaurant. When you call us, you talk directly to a friendly representative right here in Alabama, not some call center outside of Alabama with a long wait time. Your Medicare plan shouldn't be difficult to deal with, and you shouldn't have a hard time getting help. Viva Medicare has been offering Medicare Advantage plans in Alabama since 1998, and we have grown to cover nearly 50,000 Alabamians like you. Our growth has been due to 2 things: great benefits and treating our members the way we would want to be treated. We think you should trust your care to a locally owned and operated Alabama health plan like Viva Medicare that has proven it cares about its members and its community. Our promise to you is that you'll be treated like a neighbor, not a number. As a Viva Medicare member, you receive full access to the Viva Health Cafes throughout Alabama. The Viva Health Cafe is a comfortable, stress-free place to get easy-to-understand answers to your Medicare questions. You can meet one-on-one with a licensed agent or attend one of our hassle-free group meetings. We can help you enroll in a Viva Medicare plan and offer tips to help you get the most out of Medicare. You can even just walk in, sit down, and enjoy a hot cup of coffee on us. Viva Medicare members are invited to attend Member Appreciation Days, where we provide health and wellness services such as flu shots, blood pressure checks, eye exams, diabetic blood testing, and more. Member Appreciation Days are held several times throughout the year, so if you can't make it to one, don't worry, another one will come along soon. But so much more happens at the Viva Health Cafe. Every month we hold special events such as healthy cooking and exercise classes, bingo, craft days, and movie matinees. We also host sessions that cover special topics like veterans benefits or financial planning. And we offer a book nook where you can check out a book. Again, when you're a Viva Medicare member, you have full access to enjoy everything the Viva Health Cafe has to offer, and it's free. The cafes are open Monday through Friday. For directions to your nearest Viva Health Cafe or event information, call the number below or visit vivahealthcafes.com. As we discussed earlier, we have plan options for every budget, including our Medicare Advantage plans with a $0 monthly premium. I'll also give you a brief overview of some specific plans we offer, but I highly recommend you speak to a local Viva Medicare agent to make sure you enroll in the right plan that fits your specific needs. Viva Medicare Plus is one of our most popular plans that starts at $0 per month. It offers more benefits than original Medicare, such as $0 primary care physician visits, dental coverage, vision, eyeglasses and contact lenses coverage, and an over-the-counter benefit allowance. It's a great plan that helps you save money while giving you more benefits. If you are currently paying for a supplement plan with another insurance company, you might save money by switching to Viva Medicare Prime or Premier. Viva Medicare Prime and Premier provide additional benefits designed to lower your out-of-pocket cost and may cost less than a supplement plan. There are low premiums for these plans, but the benefits are more robust. Remember, some Medicare supplement designs are ending in 2020. If you are on one of these supplements, call us today and we may be able to enroll you in a Medicare Advantage plan from Viva Medicare. Our Viva Medicare Me plan is a $0 per month limited network plan that rewards Viva Medicare members with lower copays and higher annual allowances for using doctors and specialists at specific hospital networks. Viva Medicare Me is available in Birmingham through St. Vincent's and Brookwood Baptist. It's also available in Dothan through Southeast Health. Call us today to learn more about this special plan. It is an honor to help serve those who have served our country. Viva Medicare Select is a $0 premium plan designed just for people who don't need prescription drug coverage. If you're a veteran, this plan enables you to see providers outside of the VA through Viva Medicare's large network of doctors and hospitals. You can then rely on the VA drug coverage to get your medications. The Viva Medicare Extra Value Plan is designed for people with Medicare who also get help from Medicaid. If you're currently getting help from the state paying your Medicare Part B premium, call us today. You may be able to enroll in our $0 per month plan and receive a number of money-saving benefits, including transportation. In order to qualify for a Viva Medicare plan, you must live in the plan service area. Give us a call to see if Viva Medicare is offered in your community, or visit vivahealth.com/Medicare and click on 2020 Medicare Advantage Plans. You'll be able to select your county from the drop-down menu. You must be enrolled in Medicare Parts A and B. Medicare doesn't allow you to enroll in a Medicare Advantage plan if you have end-stage renal disease. However, if you no longer receive dialysis, have had a successful kidney transplant, or are on a Viva Health Employer Group plan, you may be able to join one of our Medicare Advantage plans. Hopefully, we've answered many of your questions about Medicare. Now is the time when you need to ask yourself some questions before choosing a plan. For example, can I afford to pay all the healthcare costs that original Medicare does not cover? Is there a limit to my out-of-pocket expenses? Are my doctors and specialists in my network? Is my medicine covered? Does my plan have a dental allowance? Can I talk to someone locally and in person? Which plan best fits with my monthly budget? Is my plan a 4.5-star plan? If not, why? Thankfully, a local Viva Medicare agent can help you answer all of these questions and more. We'll help you look up your doctors and prescriptions and make sure you enroll in the right Viva Medicare plan for you. Call today to get your very own no-hassle plan from Viva Medicare. We're based right here in Alabama, and we can even enroll you over the phone. You can reach us toll-free at 1-833-202-5541. That's 1-833-202-5541. TTY users call 711. You can also visit us online at vivahealth.com/Medicare or visit one of our Viva Health cafes throughout Alabama. Thank you so much for taking the time to watch Making Medicare Easy. We hope we've helped make Medicare easy for you. Please don't hesitate to call if you have any questions about our Viva Medicare plans. Thank you, Alabama. We look forward to serving you.
One of the greatest benefits that I like so far is the dental.
In fact, I used that just a couple months ago here at Viva.
With Medicare, you usually don't have dental, so that's a big plus.
And I did call them to ask about the dental, and they said, oh yeah, we really do have dental care, so, feel free. So I'm feeling free and I'm going.
It's just been really simple. Everything I've ever done with them has been easy.
I look at the bottom line, the affordability and what I get for my money. And with Viva, I've been here a year and have not been disappointed at all.
I mean, I don't like dentists, of course, who does? But the fact that I have dental now.
That's an aspect that anybody can appreciate, and I certainly do.
Oh, the benefits of Viva Medicare are wonderful.
I do receive some medications without any cost.
Oh, you meet good people here too.
It just feels good knowing that you're dealing with hometown people who really care about your health.
Just give it a try, and you will not be disappointed. It's one of the best companies that you can deal with if you are on Medicare.